All right, well, February is American Heart Month, a month dedicated to raising awareness about cardiovascular disease. It's the leading cause of death for both men and women, and I'm now joined by cardiothoracic surgeon Dr. Alexandra Kharazi to discuss the advances with treatment on high-risk cases. Good morning. So good to see you again.
Good to see you, Vanessa. Thanks for having me.
So February is American Heart Month, even though every month of the year should truly be Heart Month. What do you want viewers, particularly women who are watching, to know about heart health and kind of when it comes to that awareness for this month? What would your message be to them?
Cardiovascular disease is the #1 killer of both men and women in the United States annually. However, for women, this is a particularly important message because we're more likely to be asymptomatic and present with atypical symptoms, which means we can go longer with heart disease that's undetected and therefore present at later stages of this disease. And statistics show that only 56% of us are aware that heart disease is our #1 killer.
Right.
And go ahead.
No, why do you think so many women underestimate the risks of heart health?
I think a lot of that has to do with people thinking, oh, I'm young and I'm only in my 30s. But in fact, 45% of women over age 20 are living with some form of cardiovascular disease. So the fact that they're young and feel well doesn't necessarily mean that there isn't heart disease brewing. In fact, that's why it's called the silent killer, because a lot of the risk factors that contribute to heart disease are silent. High blood pressure, high cholesterol can go for a long time without being detected.
And is that something that could typically kind of be seen before early on at a regular physical or a regular doctor's visit when they check the blood pressure? Can they kind of get an early alert about that? Any, concerns for patients?
And that's a really big message because, yes, absolutely. And particularly with the asymptomatic component that affects women disproportionately, right? So you could be feeling totally fine, looking totally fine, but have a strong family history, and you could already be on your way to heart disease. So a simple visit to the doctor, a history, physical exam, and a set of labs can show that disease early. And the good news is these risk factors are modifiable, which means we can do something about them. So we can do something about our blood pressure and our cholesterol and diabetes, risk factors like that, and we can change the course.
And when you say that there are simple changes that could make a world of a difference, what are you talking about? Whether it's at home that people can start now, or maybe it's at their next doctor's visits?
Yeah, so lifestyle changes are the #1 contributing factor, right? So that's always where we start. And so those lifestyle choices are diet and exercise related oftentimes. So overconsumption is a big problem, particularly with food. A lot of it is just portion sizes and portion control, and also the content of the food itself.
What about cutting red meat? I'm sorry, but I'm one of those people who love red meat, but you always hear, again, just conflicting that, you know, you should reduce red meat versus, you know, it doesn't make a big impact. What would you say?
I always recommend lean proteins as much as possible, but it's really about portion control. So a little bit of red meat, if that's really something that satisfies you as part of a balanced diet, is going to make a much bigger difference than cutting out red meat if you don't have a balanced diet with all those other good foods for you, fruits, vegetables.
What are some of the top warning signs that women tend to ignore?
So chest pain is still a big one. And I know that chest pain is less likely to be the presenting symptom in women, but we still do see the chest pain, particularly when someone feels it and kind of clutches their chest. We see that depicted a lot. But it can present in other ways. So more subtle signs like shortness of breath, dizziness, heartburn, sometimes just not feeling right.
And again, all the younger women who might think that, oh, I'm too young for it to impact me right now. What are some of the things that they can do today to be proactive when it comes to their heart health?
Make a doctor's appointment. So sometimes this seems like an onerous task, so break it down into small steps today. Just find a doctor, go make the appointment, and then go see them. And it's a very simple, it starts with a history and a physical and a set of labs, and that can really change the trajectory of your life.
Oh, wow. Well, Dr. Kharazi, thank you so much, as always, for joining us. And again, check on your heart health, folks. And this goes for men and women. We'll be back after this.